washing my hands. Getting ready for this patient. Knock, knock, knock. Hi, Mary. I'm Patrick. I'm going to be your physical therapist today. How are you doing?
I'm okay.
All right. So you just had a total knee replacement on the right side? Okay. Today what we're going to do is I'm going to test your muscle ability, a little bit of your range of motion, and some of your sensories. And then we're going to try to sit you up and get you down to physical therapy. I'm not going to do anything too crazy today, but we just got to get started. How does that sound?
Sounds okay.
Can you kind of go over what we're going to do?
We're going to test how strong I am, sensation, and movement.
Yeah, that's it. All right, excellent. So the first thing I need to do is just go ahead and get your vital signs. Now, I'm going to go ahead and take it on your right arm. Have you had any surgeries or ever been told by a doctor that you can't take your blood pressure on this arm?
No.
Okay, cool. So just relax for me, please. That was 115 over 65. Is that normal for you?
Yeah, that's fine.
I'm going to go ahead and get your heart rate while we're down here, okay? And I will do this. I'm going to do a 1-minute test. Alright, so the first thing I want to do is just kind of test the range of motion on your good leg, okay? Just going to kind of jump over here. Make sure you're nice and draped. I'm going to go ahead and take this pillow out from under you. I know it's comfortable for you, but we just got to remove it because it kind of gets your knee into a position of flexion. We want to try to avoid that right now so we can work on getting your range of motion, okay?
Okay.
So I'm just going to slide that out. And how are you feeling today as far as pain goes? If we were to say scale of 0 to 10, 0 being no pain whatsoever and 10 being the worst pain imaginable.
I'd say about 4.
About 4? Okay.
Just laying here.
So I'm just going to move your good leg a little bit just to get the range of motion in your hip and knee. Looks good. Good rotation. Abduction. Good test your dorsal flexion. So that all looks good. I'm going to take some measurements on your involved side, okay? So we can get an idea of a baseline to start off with.
Okay.
We'll go ahead and just kind of see how your hip movement feels, though. So I'm going to go ahead and support you. not going to really mess with your knee right now. Maybe we'll just see your dorsal flexion. All right. What I'm going to go ahead and do is break out my trusty goniometer and take a little measurement here, okay? So if you can go ahead and try to bring your heel up towards your bottom as much as you can. All right. Okay. That is good. That is about 20 degrees. Now I'm going to go ahead and move you myself, okay? And just tell me when you don't think I can go any further.
No.
Okay. Yeah, it feels a little stiff, doesn't it? And we're about 38 degrees, so that's pretty good. Now what I want you to do is go ahead and try to push your heel down towards the end of the bed and straighten your knee out as much as you can. Is that about it? Okay. Alright, we're at about 16 degrees. I'm going to go ahead and push you down a little bit, alright?
Oh, that's it.
Okay. And that got us to, oops, sorry, let me get a little better angle here. That got us to about 9 degrees. So that's pretty good. Our ultimate goal is to get you down, get you like that other side, so, you know, right around 0 when we're at that one. Alright. So the next thing I'm going to do is go ahead and test the sensation in your legs. So pretty standard test. Just to test it up here so you get an idea, I'm just going to swipe a cotton ball on you like that, and you tell me yes when you feel it, okay?
Okay.
And can you go ahead and close your eyes for me, please?
Yes. 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 Yes.
All right. Now we're going to go ahead and take this one a little bit further and just compare how they feel from your left to your right leg, okay? So just let me know if they feel the same or any different. Go ahead and close your eyes.
Same.
Okay.
Same. It's stronger on this side.
Okay.
You only did one.
Okay.
Same.
All right. Thank you very much. And I've got one more test for you while we're down here. Basically what I'm going to do is I'm going to move your foot, and I want to see if you can like tell what position your foot is in. So we're going to go ahead and call this the up position. This will be considered down. This will be considered out, and this will be considered in. And I want you to close your eyes, and I want you to let me finish the movement and then tell me the position, okay?
Okay.
So just go ahead and close your eyes, please.
Up. Down. In. Out.
Okay, good job. I'm going to do the same test on your other foot, okay?
Okay. Down. Up. Out. In. Up.
Good job. Okay, you can open your eyes. Now I want to do another test where I'm going to do the motion on this foot, and as I'm moving it, I want you to mimic it with this other foot, okay?
Okay.
So if I were to move you down this one, you'd end up going down on that one at the same time.
Okay.
So you can close your eyes for me, please. All right, good job. So I believe that covers all the tests we need to do while you're lying down. So what we're going to do next is we're going to go ahead and sit you up, and I'm going to do a manual muscle test on you to see what kind of strength we're working with. I know surgery can be pretty intense, so before we get you up and on your feet, we just got to cover that zone, okay?
Okay.
So let me go ahead and see up here, get all untangled. And honestly, the easiest way for us to sit up is I'm going to have you get up on your elbows like this. Now I'm just going to kind of guide your lower half, and you'll just kind of walk with me with your upper half, okay?
Okay.
And before we do that, let me throw your shoes on. You can never, ever be too safe. Oh, those are nice and easy ones for me to put on. Alright, so if you can go ahead and get up on your elbows for me. I'm going to keep your involved leg as best I can straight, but I'm just going to go ahead and twist it this way. Good job. Good job. You can come down with this one. If you can just kind of scoot yourself to the end of the bed. Perfect. I'm going to go ahead and just let this one rest on the ground, okay? The doctor pretty much said that this is non-weight bearing, so we're going to do the best we can to not put any weight on it whatsoever today. How does that sound? Cool. While we're here, I'm going to go ahead and do a couple more goni measurements, because a lot of times when you move and sit up, you end up getting a little bit more bend in your knee, so we'll just check it out. Let me, actually I'm going to go ahead and put a robe on you while we're here and just get you covered up. I think it'll be easier for us both. Go ahead and just take this sheet out, all right? Perfect. Smash that there, 'cause we'll use that when we take you down to the PT room. All right, but if you can go ahead and bring your heel as close to the bed as you can to try to get some bend in this knee. Just tell me. Okay.
Yeah.
Okay, that is almost 50 degrees. That's pretty good. I'm going to go ahead and move you a little bit too, okay?
That's it.
Okay. We got you at about 66, so that's pretty good for coming off surgery. Now I want you to go ahead and try to straighten this knee up as much as you can. I know it feels pretty stiff. Alright, let's see here. We're right at about 21. I'm going to go ahead and stretch it out a little bit more, okay? Just tell me when. That's it, okay. Oh, that's good. We've got you at 8 degrees. Real good. Okay, so I'm going to relax for a second. I'm going to go ahead and get a gait belt for you, because we're going to go for a transfer down to the PT clinic. Sorry, I'm swinging around you. These gait belts can be so tricky sometimes, I'll tell you what.
They look kind of complicated.
Well, they're complicated for people like me. Everybody else seems to have an easy time, though. All right, how does it feel?
Feels good.
Good. Now that we got the gait belt on, I'm going to go ahead and do your manual muscle testing. So that is perfect. Alright, so what I want you to do is go ahead and just raise your arm up like this. We're going to go ahead and test. Don't let me push you down, okay? Good. You bring your arm back like this. Don't let me pull you forward. Good job. Let's go ahead and hold your arm up like this. Don't let me push you down. Good job. Hold your arm to your side. Don't let me pull you out. Good job. Extension. Don't let me push your arm down. Try to resist again. Good job. Put your arm up like this, and don't let me push your wrist towards you. Good job. Don't let me push you out this way, okay? Good job. This way. Good job. Go ahead and place your hand like that. Don't let me flip your palm up, okay? Good job. Let's put your hand like this, and now don't let me roll your palm over the other way. Good job. You can go ahead and put your fingers like that, kind of like a come hither position. Okay. And don't let me pull your hand down. Good job. Let's flip it over. Get your palm hand up like that. More of a stop position, if you will. And don't let me pull you down. Good job. Now if you can just go ahead and give my fingers a nice hard squeeze. Good. Very good. I'm just going to do one arm today. Normally I'd do both arms, but just to save some time, I'm only going to do you on one side, okay?
Okay.
And I would pretty much, you were great on those. I'd give you pretty much 5s and all that. Alright, so now we're going to do some manual muscle testing for your lower body. So if I could go ahead and have you lift this knee up off the ground. Yep. I'm going to go ahead and push down and just resist, okay? Good job. Now I'm going to check your rotation of your hip. Lift your hip like this. And don't let me push you down, okay? Good job. Now if you can go the other way with your foot, don't let me push you down. Now don't let me pull your knee towards me, okay? Good job. Don't let me push you in. Okay. Good job. Go ahead and get you up like this. Don't let me push you down, okay? Okay. Good job. And don't let me pull your foot towards me. Good job. Switch up here. If you can go ahead and point your toes towards the ceiling. Don't let me push your foot flat on the floor, okay? Good job. Just gonna slip this off real quick. You can just try to point your big toe up. And don't let me pull that down. Good job. I'm gonna do a few tests on this other side. We're not gonna mess so much with the knee, but I'm just going to kind of check your hip, okay? And if you can you try to lift your leg up and get it off the floor? Just let me test that. Ooh, okay. Yeah, that's understandable. That's totally understandable after surgery. And I'm going to try to pull you out. So, yeah. Just a little push in. Okay. We'll go ahead and jump down to your foot. There's a little bit of weakness in your affected leg, but that's completely normal. So no worries, that's what we're here for, is to get better, okay? So can you go ahead and point your toes up? Good job. I'm going to slip this off. I'm just going to check your big toe, okay? And don't let me pull it down. Alright, good job. So now that I've got the muscle testing taken care of, we are going to transfer you over to the wheelchair, and we're going to head down to the PT clinic, okay? So let me sit you situate this over here for you. Get these out of your way. I'm going to go ahead and lock her in. Slide it over. Okay, the way we're going to make this transition is I'm going to give you a cue when we're going to stand up. And like I said, we don't want any weight going down on your affected leg. So basically I'm going to say 1, 2, 3, and up. And then we're going to pivot on your good leg and sit you down. How does that sound?
Sounds good.
Okay. So let's go 1, 2, 3, and up. Good job. Just kind of pivot. Reach back to that chair. Sit down. And our wheelchair will have a trusty little spot here to keep your leg elevated. Let me go ahead and get this one out, get you more comfortable. Let's go ahead and drape you. I know it's a little drafty out there, so we want to get you as comfortable as possible. And head on down to physical therapy. And can I say what a wonderful patient you have been so far.